Anybody know what the typical or most common drug for attention deficit disorder is? It's called a class 2 narcotic. It's also the number one drug traded on college campuses. It's called kitty cocaine or Ritalin. It's a stimulant. So wait a second, we're starting to see this, but I got an idea. Okay, we give a little kid a stimulus, so he has trouble sleeping at night, but he can pay attention in school a little bit better, although the studies show that doesn't really help. And they're so wired up at the end of the night that we can give them a sleeping pill to knock them out. Problem with that? Anyone? Bueller? Yeah. Okay, well, let's take a look. Now, between 2000, again, same study, women use prescription sleep aids, particularly among young women under 19, 37% increase. And those between 20 and 64, 58%. Now, remember, what do these sleep aids do? Okay, I'm sorry, what does this chemical designed to knock you out do? Does it limit REM state of sleep? Does it limit your body's ability to repair itself? And having that limited amount of repair, does chronic disease states develop? Yeah, absolutely it does. Now, if you miss one single night of sleep, now my son's going to chiropractic college, 32 units a trimester, he may pull an all-nighter. I'm going to recommend him not to do that. Why? Because if you miss a single night of sleep, it can take up to 2 weeks to recover. Okay? That's not appropriate. So you get 2 hours of sleep between 11 and 1 o'clock, and you'll be able to function. So people that are pulling all-nighters, it's not healthy or good for you. This is huge. Journal of the American Medical Association. Inadequate sleeps affect hormone levels. 2 weeks ago, we talked about women's hormones, also male hormones. The change in sleep triggers shifts in the endocrine systems, altering hormone levels and metabolism. Listen to this part. Researchers say that this study shows that a good night's sleep may be a natural form of hormone therapy, particularly in older adults. Say it with me. Wow! I know! If you didn't know that, so is deep sleep. Can sleep be used as a health tool? Absolutely it can. Now this is interesting. Fibromyalgia, considered incurable by most doctors. Understand, you can see that spine's not straight. Typically, people will get treated with chemicals. So they have muscle aches, they get pain relievers. If they have muscle spasms, they get a muscle relaxant. If they have, say muscle pain, muscle relaxants, are they going to be happy or sad? Prozac, okay, that's the side effect is muscle aches and joint pain. Is this going to upset their stomach? Antacids, okay. Now, typically, since you're taking 4 medications and you're still hurting, and you're going to have trouble sleeping at night. Yeah, absolutely. So you get the sleeping pills. The problem with, we just talked about, if you're taking a sleeping pill, your body can't repair itself, so it's going to cause all those other symptoms. This gal here, 9 medications. There she is, 90 days later, no medications. So start correlating symptoms with your body's ability to repair at nighttime, which is vital. Vital. Now, this was out of the University of California, San Francisco. Sleep in early life may be a crucial role in brain development. So now you're going to find out the REM busters are the things that stop REM state of sleep, watching TV before night. And we're going to talk about why. But understand, if kids aren't getting the sleep that they need, can this change brain development? Well, they say it can. The capacity for change or growth and strengthening of connections between nerve cells is the basis for development of the brain. The elaboration and refinement of neural circuitry continues to be a lesser extent in the adult brain. So it's vital that kids get deep sleep. Vital. Wait a second. It's vital that kids get deep sleep. So that means that they need to get REM state of sleep. So would it be scientific to give a child a sleep drug? Or would that be toxic and dangerous and destroy their body's ability to repair itself? Well, let's look at this. This is out of the Journal of Pediatrics. 38% of pediatricians use pills to help children with sleep onset delay. Does that sound like a new buzzword? Sleep onset delay syndrome. Okay? Are they kidding? Is this a made-up disease? How about we find out what's causing the kids' sleep problems instead of drugging them? Well, first off, this is true. This is out of the Medical Post. 85 to 90% of drugs used on children are not approved for children. Ever see a children's sleep drug study? I never have. This is an interesting one. FDA approved Vioxx for kids before it was pulled from the market. Now, this is a pain reliever that killed 70,000 people before it was pulled off the market. So if you have kids and they're taking a prescription, there are always healthy alternatives somewhere. Okay, we need to find those. Now, error drug rate, 5.7% drugs in kids. Now, this is medical errors and adverse drug events in pediatric patients. Journal of the American Medical Association. Ordering the drug, 80% of the time there was a problem. Incorrect dosage, wait. Did I read that too fast? Problems, ordering a drug, 80% of the time. Incorrect dosing, 34% of the time. Anti-infective drugs, 28% of the time. Intravenous medications, 54% of the time. Medical errors are common in pediatric inpatient settings. Okay, so we must watch. So what did they say? At best, medicine is 20% on science. Some say it's only 4%. Read this backwards. Between 80 and 96% of the time, a medical doctor is giving you advice for medications or for certain therapies. It's not based on science. I'm a science guy. I'm just pro-health and pro-human. If it affects your body in the positive, then it's good for you. If it affects in the negative, it's not. First off, here's a fact. 40% of all prescriptions written are for depression. Now, is this a chemical product designed to make a profit? Yes or yes? Okay, of course. I have nothing against companies wanting to make a profit, but I do if they create a need for this. So 40% of all prescriptions are for depression. Now, stress is the main cause of depression. We talk about stress. There's several effective ways to deal with it. The problem is sleep deprivation is a main cause of stress. So now, how many people are taking an antidepressant along with a sleep aid? Is that a very common prescription pattern? Yes or yes? Huge. In fact, Prozac is the #1 medication in our country. Doctors are using everything, including children, but it's never been, tested on pediatric populations. This is interesting. The fastest growing segment of users were preschools, ages 0 to 5. Any definitive blood test that shows that you require Prozac? I'm sorry, is there any test of any kind that shows that a human body, and particularly someone less than 5, should require it? I don't think so. Now, and just the way they say, most antidepressants have never been tested on children, and antidepressants can cause painful headaches and tooth grinding. That means it causes an increase in anxiety. Would that also cause sleep disturbances? Well, this is the alternative from you personally taking medications or from kids taking it. First off, no TV before your bedtime. No one's going to say, why, Doc?
Why?
Thank you. Well, first off, have you ever been driving down the road, all of a sudden you realize you're like 5 miles further than you thought you were? Okay, what you experienced was white line fever. You didn't pass out, but under rhythmic images, your brain goes into what's called a beta wave state, where it's almost a hypnosis state. If you're watching television, you're receiving these rhythmic images, so your brain gets shut down. And it's really easy to watch anybody who has a controller on their belly vegging out of the television. They're under a semi-hypnotic state. Now, if you go to bed like that, you can't achieve the deep state of sleep. If people fall asleep with the TV on, again, you won't be able to achieve the deep state or the REM state of sleep. So no TV before bed. What that means is you can watch TV right up before bedtime. For 15 minutes, you have to physically read. And this doesn't mean reading on the computer, because a computer screen, you're still going to get those rhythmic images. You have to physically read a book, hopefully something real boring. Okay, Book of Numbers is phenomenal.